Hello, everyone. My name is Irene Hedden. I am an assistant professor at Drexel University. My work generally focuses on structural racism and maternal health inequities. And system dynamics has been a tool that I've been using, to help explore structural racism as a system that drives persistent inequities in maternal health outcomes over time. So this is the second session of the Community-Based System Dynamics Workshop Sprints, the second of 3. And today we're going to be doing a quick recap of session 1, and also transitioning into a review of behavior over time graphs and questions on the homework activity, and then do an introduction into the causal loop diagram, basically systems mapping, system visualization structure. And then we're going to do a practice activity. We'll break out into small groups, and we'll work on using the tools that we learn about how to draw causal loop diagrams in those small, in kind of building out a causal loop diagram. And then we'll round out with translating all of these tips and tools in our understanding of complex systems into what does it mean to do this in a group setting? How do we think about design considerations when we're translating this into a bigger group that we want to, consistently lead across a systems learning and systems production kind of endeavor. So that's the agenda for today. Again, last month we did the intro to CBSD and what does it mean to define a problem, a complex problem. And today we'll be moving on to session 2, which is getting more into scripts and Scriptopedia, which are the tools that we use to scaffold that learning. And it'll become apparent how that fits into learning causal loop diagrams as the talk unfolds, and then we'll wrap out with design considerations. If you're able to make session 3, we'll be kind of transitioning into a more applied, like, how do we apply these tools to our own problems? So building on the homework, part of it was starting to define, what is your own problem, the reference mode and all of that. And session 3 will really be leaning into building out those problems in small groups, and also thinking about what are the design considerations that you might want to consider in transitioning your own problem into a group model building or community-based system dynamics context. So just a quick reminder about our group agreements. It's important to create learning spaces where everyone feels included and that they can ask questions and engage. So we'll just post these really briefly. If Christopher or Michaela, if you can put them in the chat so that we can all kind of reference back to them. They're briefly just try on new thoughts and kind of perspectives. Intent does not equal impact. So be sure that if you have an unintended impact, that you acknowledge that, even if it does not align with the intent in which you engage in the action or conversation. Practice mindful listening. Practice self-focus, so really speaking from a perspective of your own experiences. Practice both and, so that we can kind of acknowledge that there are inclusive realities, and also kind of the standard move up, move back. If you talk more, maybe pause before you comment, and if you talk less, maybe challenge yourself to speak up in whichever way feels comfortable. Of course, we have the chat if that feels like a more comfortable place to post questions or whatnot. We also have the Padlet, which is, the link is on the bottom here. And Christopher, if you can put that in the chat, where you can post a question or a comment, and we'll kind of get to those. And then also, if there's a question and answer session or point of time, which I'm hoping to have, feel free to use the raise your hand button to engage. So those are the group agreements. All right, so I did want to acknowledge that there were 2 questions that I did not get to from session 1 that were in the Padlet. And this is a very text-dense slide, so don't worry about the actual text. This is more so that when you get the slides afterwards, you can remember the answers to the questions. So right now, just kind of go into listening mode while I answer, kind of talk through the answers to this question, these 2 questions. So one question was around
submit them.
Sorry.
In the next couple of days.
Oh, sorry, is that someone who's not, is that a
Yep,
question?
you got it.
Okay, great. Um, So one of the questions was, what are measures of success in community-based system dynamics? And of course, asking because donors want that $1 million question, how are we going to measure success? And I will say, so with regards to measures of success, it really depends on your goal or desired insight for the group model building session. And that's something you'll develop with the stakeholders you're working with and with what's called your core modeling team. We'll talk about that more later in the lecture today. But it can be really dynamic, right? It could be a specific deliverable, such as a causal loop diagram, um, a set of behavior over time graphs, kind of aligning what are the variables and their change over time, or a particular report. So for a project, for example, I'm on, one of the deliverables or measures of success is just having this report summarizing what we did and the systems insight that we identified. But there are also kind of a larger conversation in the field about how do we get at measures of like increased consensus among participants, because one of the kind of appealing pieces of group model building is that it takes those kind of disparate mental models around the elephant and works to iterate across them to more comprehensively understand the problem. So how do we capture that consensus building? How do we capture that shift in mental model? And there's some tools that are more kind of like, you can do it by qualitative inquiry. Some projects that I've worked on have developed kind of pre-post surveys with kind of systems concepts and kind of eliciting how people are thinking in a linear or systematic way before versus after. But this is really an evolving kind of trajectory within the field. And I've put a link to a paper, a recent paper actually, I think came out within the last few months, summarizing across the literature what different approaches people have taken to measures of success. So hopefully that can help you iterate to one that your donors will be happy with. But I do think highlighting that it's a dynamic process that will evolve or co-evolve with your group model building stakeholders is an important piece. So the second question was, what do we do when we have agents acting within a larger system dynamic? Do we squish the model together? And this is going back to the fact that complex problems can be solved with a whole host of tools. So there's, system science broadly deals with how do we address complex problems, and system dynamics, which is the method we're learning across these three sprints, is more specifically a one approach to solving or understanding complex problems. Agent-based modeling is another approach that one could take. And I would say the difference between the two really have to do with what you think is driving the complexity in your system. So if you really think it's kind of like individuals moving around a space or in a context that are making decisions in an interactive and complex and dynamically evolving way, then I would say starting with an agent-based model might be better, because that's really going to get you to the crux of those intervention points that you need to actually change the system in ways that are productive. Now, if you think it's that more, yes, there may be these agents operating, but it's really this larger aggregate system that is really shifting the ways in which folks can move through a particular problem or decision space. And it's really kind of the feedback between concepts or dimensions at this higher level that matter, then I would say, start with the system dynamics level. And that's where you're really going to get the complex behavior insight that you need. So I would kind of push to say, is it really that you need insight on both levels, or is one kind of, higher, more, not more important, but will give you more insight for the particular problem that you're working on. That being said, there are approaches that do smush the models together, for lack of a better word, or rather kind of co-locate the both modeling approaches within one project. But those are very both labor intensive and computationally intensive in terms of computing and modeling, if you get to the kind of formal modeling piece. So that's just something to consider. There is a paper, again, that I linked here talking about how to smush those together if you do indeed want to go that route. So those are the two questions from last session. I'm going to do a quick recap, and then we're going to do a brief review of the homework, and then I'll take questions after that just to make sure we're on schedule. Again, if you have questions that are coming up over the talk, feel free to pop them in the chat or pop them on the Padlet. All right, so last session, we really got introduced to complex problems. So complex problems are ones that are defined by changing over time dynamically, so not having linear change over time that we may, be able to predict with just like if we change A, we'll get B, but really having like this kind of feedback behavior that changes and creates a dynamic pattern over time that we can't easily predict with linear kind of approaches. They have time delays between the action and response. So an action may happen 5 years before you actually see the full impact of the response. There are feedback loops linking factors together. So again, as I mentioned, it's not just that A causes B causes C. There's actual feedback where, say, the outcome of C feeds back into A to shift the way we can understand the outcomes of the problem. And then it's also history dependent. So the actions that you see today are a product of the accumulations of actions that have happened in the past. Finally, complex problems often are characterized by counterintuitive behavior and policy resistance, which is just this quality of if you implemented a policy based off of your known knowledge of the system, but you don't actually see the results or the changes that you would expect, it may indicate that there's some complexity going on that's either norming the system back to a normative behavior or created unexpected, again, counterintuitive behavior. And I just put the iceberg here because that was kind of the heuristic of what kind of the journey that we're going on in implementing these system dynamics tools, both with our own capability building, so going from events to patterns over time, to the actual system structures, creating the patterns over time, and eventually to the mental models that are informing why things are structured the way they are in the first place. But it also scaffolds the way in which you'll guide your groups or your participants through a group systems learning session or a group model building session once you kind of get to that stage. And a second piece of the recap was that those mental models at the bottom of the iceberg basically are characterized by how we think the world works, right? It's our internal conceptualization of the external world and our experiences in the world, right? And so I put a reminder of the elephant, right? Because if 5 different people experience an elephant and they have never experienced one, they're all going to have different perspectives of what an elephant is. And they all will be technically right based on their positionality, but it's only through iterating across all of those perspectives do we actually understand what an elephant is. And it's that iterating through all of perspectives is what the participatory SD methods provide. And in last session, we did a quick distinction between group model building and community-based system dynamics. Both are participatory, but community-based system dynamics really focuses more on this process of shifting power and ownership from those who are considered traditional knowledge holders to the communities who are impacted most by the problem, and also really considers more the kind of power dynamics that are important in making sure that community is leading the actual understanding and intervention on the systems that are constraining, whatever problem they're working on. And finally, we ended with kind of the first tool in, getting us down the iceberg is to define a complex problem and to visualize that in a reference mode. And a reference mode is just a descriptive visualization of dynamic behavior. And it's usually characterized, or it's always characterized actually by time on the x-axis. Time can be months, years, days, hours, minutes, whatever matters for your problem. And then on the y-axis is the variable of interest, and that can change from in a kind of quantitative perspective, so here it's like 0 to 100%, or that can be a qualitative change, so low to high, some to a lot, right? So the reference mode is just a descriptive visualization of the dynamic behavior of our problem of interest. And that set us up for our homework, which is taking the tools that we learned in drawing a reference mode to expand that so that we could understand the patterns over time of different factors that may influence the problem we're interested in solving. So a behavior over time graph is just a graph showing the patterns for behavior of variables related to the problem or focus of the problem or focus issue, which can be used to refine the reference mode. And again, as I mentioned, the key characteristics of a behavior over time graph is that there's time on the x-axis, so this horizontal axis. And again, time can be any measure of change in time that you would like. Again, months, minutes, hours, years. It can, even if it's a seasonal process, be seasons, right? Or calendar time, so like January to December, if it's kind of a cyclical process, but time must be on this horizontal axis. And then on the vertical axis or the y-axis is the variable of interest and the measurement scale. And so that's where you would put a numeric scale, whether it's like 50 to a million, 10% to 200%, or it could be a qualitative measurement approach, which is like some to a lot or low to high, right? And then in this axis space, you want to delineate either where you are now, so you can represent the accumulations till now, so the history of how the system has behaved, and you would draw that behavior in this space. And then beyond that dotted axis, you would draw your hoped for behavior and then your feared behavior. And in that way represent, again, that dynamic change over time as you understand it. A final note is all behavior over time graphs should have a title above them so that we know what you are talking about. All right, so now we're kind of moving on towards, we've talked about reference modes, we've talked about behavior over time graphs, which is expanding the use of that tool of looking at patterns over time that we used in the reference mode to understanding the other variables of interest as patterns over time. Now we're going to talk about how do we take all of those variables and change them into an actual causal loop diagram or system structure. So, and the importance of doing that is that when you have this full set of deliverables or outputs, what you have is an actual visualized dynamic hypothesis of the problem at hand, which is just a theory about what structure exists to create the reference mode. So if you were doing this on your own, this would be your own dynamic hypothesis. But when we translate this to a group setting, then you have a consensus about the dynamic hypothesis that's creating the problem over time or the reference mode. So that's kind of the context in which you get to in creating the causal loop diagrams and then doing this in a group model building process. All right, so causal loop diagrams are visual tools to illustrate the relationship between variables that create the system. So again, you're taking all those independent variables, how they change over time, to then actually show how they're explicitly related. And drawing causal loop diagrams requires understanding a few tools and tips of the trade. So we're going to go on a journey of chicken farming to understand some of those tools and tips of the trade. So there's this chicken farm, and the goal of this chicken farm or the farmer is to increase his chicken population. So he has his graph about his chicken population management. He's seen it rise for a while, then he saw it plateau, and he really wants to figure out how to continue to increase the chickens that he has, or the chickens that they have, and avoid continued decrease of the chicken population. So the first rule of a causal loop diagram is kind of a basic thing that this chicken farmer thought about when they decided they wanted a chicken farm, is that if you have chickens will create eggs. And so these are the first kind of three elements of a causal loop diagram. The first is that the blue words are variables. So all of those variables that you wrote down in your homework or that you then created behavior or time graphs of, you would first start by representing them by just writing them on the paper, right? So write chickens and write eggs, and those are variables. The second tool of a causal loop diagram is this arrow. So the arrow represents a causal relationship, and the directionality of the arrow represents which variable is the cause and which variable is the effect, right? So in this case, because the arrow leaves chickens and goes to eggs, the chickens are the cause and the eggs are the effect. So if you have chickens, you have eggs. Now, the third element that's important for drawing causal loop diagrams is that if you have if you start with chickens and chickens create more eggs and they go in the same direction, basically the effect is in the same direction as the causal variable, then you have a positive polarity or a positive causal relationship. So that's the first thing of causal loop diagrams. You're representing variables, their relationship, and if one increases the other, then you have a positive causal relationship. Now, a positive causal relationship just means that the two variables at the end of the arrow move in the same direction. So I could similarly say, if I have less chickens, I have less eggs, and that's still a positive relationship. So I'd use a little plus to indicate that, but they're both going in the down direction rather than both going in the up direction. So that's rule number one of causal loop diagrams. Now, all of us who kind of passed the basic biology class know that chickens or eggs also create chickens, right? And so the next part of the chicken farmer's kind of goal is to increase his chicken population by fertilizing the eggs and creating more chickens. So again, if you have more eggs, you have more chickens. So that's a positive polar relationship. So there's a little plus going into that arrow. But we also know that chickens don't come out of eggs fully grown, right? They first have to go through this really cute chick phase, right? And to represent that time delay between when an egg becomes a chicken, you use a double hash mark on the body of the arrow. So that double hash mark represents a time delay and any causal effect that you're interested in, right? In this case, again, it's chickens need a little bit of time to grow up. Our eggs need a little bit of time to hatch, grow up, and become full-grown chickens. Now, our third element of a causal loop diagram is that once we have these closed loops where chickens create eggs, eggs create chickens, chickens create eggs, we're on this great kind of exponential growth trajectory, we can actually define the directionality of that loop behavior. And in this case, this is a reinforcing loop, meaning that the directionality of that first variable, so chickens, is only reinforced by going across the loop, right? And so this, again, is an exponential growth pattern of, in this case, increase. So more chickens, more eggs, more eggs, more chickens, more chickens, more eggs. But this also can represent vicious cycles where you have basically a downward spiral where less chickens, less eggs, less chickens, less eggs. So both directions are represented by a reinforcing loop. And you do indicate that by having an R in the center of your closed loop. Now, the chicken farmer has been going on for a while. They're going great with their chicken population, but one day they go out and notice that there's a chicken that's dead on the road next to their chicken coop, right? And it's not only this day that they notice it, but it's over time they keep noticing these increases in chickens' deaths. So these chicken injuries, the more chicken injuries that they're seeing, the fewer chickens that they are having in their population. And so that's our next tool for drawing causal loop diagrams, is that a minus sign means that there's a negative polarity or an inverse causal relationship. So when we have more chicken injuries, we have fewer chickens. And that is switching the behavior of the system from exponential growth to kind of a balancing out behavior that in this case is not desired, right? And so in order to understand the full reasons why the farm is going in a direction that he doesn't want it to go in, the farmer puts out a camera and actually finds out that The chicken density in the farm, as you can see, is getting pretty crowded. So once the chicken density gets really crowded, the chickens are uncomfortable, so they cross the road. When they cross the road, they're actually getting more injuries, and the more injuries are decreasing the chicken population. So again, it's using the same building blocks of like linking variables with arrows. So more chickens, more chicken density. That's a positive polar relationship. More chicken density, more road crossing, again, positive polar relationship. More road crossing, more chicken injuries, again, a positive polar relationship. And more chicken injuries, less chickens. And so once we have that closed loop, we can learn our final tool of drawing causal loop diagrams. And that is a balancing clock, a balancing loop is basically a loop that when you start out with a behavior in a certain direction, when you go around the closed causal chain, you end up with that same variable moving in the opposite direction. So we start out with a certain number of chickens, and while by the time we get around this whole causal loop, we have fewer chickens. So that is a balancing loop. All right, so those are all of the tools that you need for drawing causal loop diagrams. Are there any questions before we move on to, we're actually going to do a choose your own adventure thing since we're a little bit short on time, but are there any questions about any of these kind of tricks and trades of drawing causal loop diagrams, which is again moving us, giving us the tools to move from the behavior over time graphs to the actual visualization of the system structure? Any questions? Okay, well, hopefully you'll post questions in the chat or question. Again, there's still the Padlet if you come up with any questions over time. And so then there's kind of two ways we can go with the time that we have. So we have about 20 minutes remaining. There's a quick practice exercise where actually, maybe we'll do this in a group exercise. So I am going to, hopefully I can visualize you all now. And we're going to test out our causal loop diagramming skills and start to add to this partially done causal loop diagram of those factors driving AI bias in healthcare algorithms from the Boston Globe article. So instead of spending 5 minutes in your groups to do this, we'll actually do this by a voting process, which we'll see how this works. And actually, we'll do this via a voting process, and I'll ask some questions and you all will tell me what the answer is. And I'll give you 2 minutes to or actually I'll just go through this quick narrative to help anchor everybody in the process or the context that we're in. So basically from the Boston Globe article, there are these 6 factors, which are the diagnosis accuracy, the accuracy of existing data on whatever disease is of importance, the accuracy of historical data on disease, and then the doctor's assessment of symptoms, the patient's actual symptoms, and then the treatment that they receive. All of these things are changing things over time. And in this narrative, basically it's saying that in order to accurately select a diagnosis, AI-based algorithms base their prediction on a patient's symptoms, existing knowledge of the disease, and the historical knowledge on that disease. However, often there is information on, often a patient's symptoms, though, are filtered through a doctor's assessment of those symptoms. So the actual information that an algorithm gets is through something like not ER records, electronic medical records, that a doctor represents those interpretations of the patient's symptoms. And the more existing data there are on symptomology and related diseases, the more accurate the doctor's assessment will be, as well as the information going into the algorithm. And better diagnosis leads to better treatment, which in turn decreases patient symptoms over time and thus decreases the need for doctors' assessments over time as well. And furthermore, over time, as accurate diagnoses accumulate, the available data for future diagnosis will improve. So we'll sit with that for a second. And based on the story I just told you, if I wanted to link an arrow between doctor's assessment of symptoms and, say, accuracy of existing data on disease, what direction would that arrow go, and what polarity would that arrow be? Anyone can raise their hand and speak up. Or put it in the chat. Or ask a question if you're confused.
Can you repeat the question, please?
Yes. So if I wanted to link this variable of accuracy of existing data on disease with doctor's assessment of symptoms, which direction is that causal relationship? Like, is it doctor's assessment affects accuracy of existing data on disease, or existing data on disease affects doctor's assessment of symptoms? And also, what polarity? Is it positive or negative?
I think this one's interesting because I feel like it's self-reinforcing, where, you know, the doctor's assessing a symptom that goes into a database. And then that database is now used to look at whatever diseases, all these symptomologies, and then that's going to reinforce a future doctor's assessment of symptoms. And so I feel like it's a circle that's like positively reinforcing each other.
Yes. And I think that's also what was represented in Jessica's response. The accuracy of existing data on disease is the start of the arrow pointing to the doctor's assessment. Yep. So that's part of the loop that Christopher described. And it would be positive polarity. And then it would be reinforcing, Jessica, if it closed that loop backwards into the accuracy of existing disease. But we'd have to know that it made that closed loop in order to say that it's reinforcing. But right now, it would just at least be a positive relationship. So, yeah.
I think that I was assuming for the reinforcing that, like, doctors write research articles or like that kind, and then that could reinforce the accuracy of existing data. But yeah, that's kind of where I was going with that. But I'm glad I'm at least headed in the right direction.
Yes, you're at least headed in the right direction. Great. So that's a practice activity that I will post for you all to do. You can do it yourself and then add, basically draw in the missing arrows that you think operate in this system. There are no right or wrong answers. And then we'll share out next month, and get feedback on what folks thought were going on in the system. But this is just a practice activity that you all can do. All right, in the final few minutes, I do want to talk about how we go from using these tools to understanding causal loop diagrams to actually, and behavior over time graphs, to actually designing and engaging a process with groups, right? Because we don't want to just do this on our own. And so teaching the process of causal loop diagramming and promoting system thinking in a group requires some structure. And to facilitate the structure, there are actually existing scripts that are designed activities meant to walk folks through the concepts, tools, and actions needed to create the informal maps that are foundational to system dynamics. So the chicken and egg example that I just gave you wasn't just one that I came up with on my own. It's actually one of the scripts that's in Scriptopedia, along with the narrative of the chickens and eggs. And you can tell it in, however way that you want to, but it gives you how to walk through that presentation to actually facilitate your group with the tools that they need to then go create causal loop diagrams either on their own or in small groups, right? So Scriptopedia is a repository of these different kinds of scripts that can walk you through causal loop diagramming, helping groups to create their own causal loop diagrams, and also helping those groups to actually create behavior over time graphs. And from the scripts that are in Scriptopedia, you can actually start to intentionally design a process that makes sense for learning about not only building capabilities in your group, but also learning about the variety of people's mental models in the group, as well as eliciting consensus as you all work to see what similarities and differences are present from those different positions of folks across the elephant, in that kind of heuristic of why we're doing group model building in the first place. So oftentimes you start out your group model building workshops with that presentation of the reference mode. So those are the activities that activity 1 in the homework. Then you do, so they're iterating what are called convergent and divergent activities. Convergent just means you're getting the variety in your group's mental models. Convergence just means you're trying to take that variety and have the group move toward a consensus on what are the most important parts of the system that matter for the problem that you all are trying to solve as a group, right? So after presenting the reference mode, the script then has a divergent activity where everybody draws their graphs over time. You literally have like stacks of paper where everybody has their graph over time, and they share them out on a wall where you tape them into themes. And then you have a convergent behavior where people vote on what are the most high priority pieces of the system that matter for how we're thinking about what we want to change. Then you would go into, again, this is all in Scriptopedia as well, a group of, showing what a causal loop diagram is, and then breaking out into small groups to have people change those variables that you identified and then voted on in the previous scripts into the actual system structure, linking those variables. And then once you have all of those individual causal loop diagrams from small groups, you then synthesize it into one large causal loop diagram. And then you can also get people's feedback on where are the best places to intervene or best places to mark intervention, and then have some reflection and discussion on whether this, brings you to consensus as a group. But oftentimes, if it doesn't, you'll keep iterating across different group model building sessions with either the same stakeholders, or if it becomes obvious that there's a stakeholder missing, you might then do a series of group model building workshops with that stakeholder group, right? And so that's how the activities that we're talking about coalesce into an actual kind of structured learning that happens within your group model building sessions. Another set of key building blocks of group model building sessions are that each of the scripts has what are called artifacts. So they're just those outputs from the script. So on the whiteboard today, I was having you all post those behavior over time graphs, right? Those could be artifacts from that process, right? Then in the next activity, those would go into voting by dots, right? And dots are just like those little, those little stickies that you stick prices on to say like pottery or art at an art festival. You just basically give participants those dots, and then they stick those onto the papers and vote on what's most important. Those variables then go into making a causal loop diagram, and then those causal loop diagrams go into one large causal loop diagram. So each output from the previous script builds into the next set of activities and learning needed for the subsequent script. And so in that way, again, you're really scaffolding the learning, and it's not just throwing your participants in cold. And also, it's important to make sure that this learning has a community and cultural fit, as this is especially true for community-based system dynamics. And in order to facilitate that community fit, what you usually do is have a co-design process in which you're not just sitting here thinking about how you're going to put the scripts together for your group model building process. You're actually working with a small set of key stakeholders that will actually work with you to design that session for the larger set of stakeholders across which you want to gain insight, right? And so this core modeling team is a group of 5 to 7 people representing key stakeholder groups that are tasked with designing the group for the larger set of stakeholders. And you work with them over 5 to 7 2-hour meetings, where you not only teach them kind of the technical skills of system dynamics themselves, but also have them help you think about what are the technical aspects of the group model building session that are important. So the problem statement, the script selection, those kind of ways to convey, like what is a positive polarity versus negative polarity relationship, like what language do you need to actually communicate that? but also think through the qualitative aspects of design. So how do we need to think about power dynamics in this particular group? How do we need to think about group availability? Is everyone available at the same time? Are there appropriate spaces where we need to hold this, where we can make sure that participants feel safe to share and don't have either historical trauma or just kind of friction with a certain environment? So these are all of the aspects that your core modeling team works with you to co-design in building a group model building process. So you definitely need people who are process heavy so they can really deal with process conversations, but also folks who are aware of and can communicate community engagement needs. And the design process is often captured in what's called a facilitation manual. And it's basically documenting all of the design decisions that you've made and that are important for actually implementing the group model building process. And this is a screenshot of one for a set of group model building sessions that I just did in Philadelphia. And the example links actually to the facilitation manual, so you can actually see how each of these design processes are built out and how these scripts fit together into a holistic group model building session. A final note, once you have this, there are a lot of different tools to facilitate this process. So I'll refer you in the readings to the depth of that in the Peter Hoffman's book on community-based system dynamics. But in the facilitation manual, one of the key elements that you need to translate the design ideas to the actual implementation is having a facilitation team. And we'll go over those roles of the facilitation team and considerations in the next session as we're actually thinking about the practicalities of translating ideas into action for your own group model building or community-based system dynamics projects. So that's really the end of what I had. I know it went really quick, and I'll kind of describe some of the elements that I went through quickly in more detail and some kind of explainers that will go with the homework. But the main takeaway is that there are causal loop diagrams that follow on from behavior over time graphs that help you explain and visualize the system that is driving the patterns over time across the variables that you're interested in. And scripts are key tools in helping to facilitate this learning from events to system structure that you'll need to engage in when you're doing this in a group. And finally, the co-design process with a core modeling team is foundational to actually doing this in a way that is representative of and responsive to the communities that you're doing these activities within. All right, so I'll pause there. I know we have like 4 minutes. So I apologize for rushing through stuff, mostly due to of course, technical issues with the group activities. But I'll pause here for more questions if anyone has any. And while we're waiting, I will put up the survey for folks to fill out. So any questions? Any points of confusion? Okay, well, please fill out the workshop, what is it, the survey, the evaluation survey. And post questions in the Padlet if they come up while you're either doing the homework, rewatching this video or any other video. I do check the Padlet intermittently. And if I see any more real-time questions, I'm happy to respond to them. I know there's one question right now from the homework on chapter 1 that I'll send out a response to when I send out a summary and the homework for this session. But yeah, I really just want to thank you for your participation. Thanks for being in the process with us, and we'll definitely troubleshoot those tech issues, because I really would love it if folks can actually kind of start to engage with and do the activities, because I think that's where a lot of the learning is. So thank you so much.